So I'm going to talk a little bit about a variety of compounds. They're all kind of scary. So if you're squeamish or if you really like one of these, feel free to, step out for a minute. I understand because all of us have our likes and dislikes, but you really ought to not step out. You really ought to know what the literature says about each of these things because they're also very important to cardiovascular disease. And so let's talk a little bit about sugar. You probably all remember this from school, that you've got your table sugar, which is sucrose. It's a disaccharide, meaning that there's two sugar molecules put together that make it twice as sweet. Not really, but fructose is mostly in fruits, and glucose is in a variety of things, including vegetables. And if I had to pick one thing to raise the iPhone and take a picture, this would be it, or just find it on Google. What I'm going to spend the next few slides talking about is insulin response, and that's because insulin increases plaque, so-called atherogenesis. And so if we could actually have our sugar and have it bathed in something that would stop the insulin from going up really fast, that would be the best scenario. Well, guess what that something is? Fiber. And so having fruit is not as dangerous as having table sugar, even though they might be both sweet, because the table sugar has no fiber and the fruit does. Now, there are some exceptions up there on the left. Grapes, fantastic amount of sugar, not a lot of fiber. But you have strawberries, raspberries on sort of more on the right, where the amount of sugar is lower compared to the amount of fiber. So it's just something to think about. And after I saw this graph, I actually think about this every time I'm about to pick some fruit, and I'll pick a variety of fruit. If I've got grapes, I better get some blackberries to go with it. It's just a thought process. Okay. So I'm so concerned about insulin because insulin is a growth hormone. It makes nutrients go into cells. That sounds like a good thing until you realize that it's not just sugar. Sugar is converted to fat, but also fat uptake. It really does drive nutrients into cells and makes you store them. And so insulin actually makes people fat. And so everyone grows up thinking that diabetes is a lack of insulin. No, it's a lack of insulin sensitivity. And the people who are obese, who have so-called type 2 diabetes, they have more insulin than the thin people. It's just that it doesn't work because the tissues we want more and more and more. Like a crack addict, they've got to have more insulin, and so the blood sugar starts going up because the insulin isn't enough. And so with that, and knowing that higher levels of insulin leads to more plaque and more cardiac events, that's the thing to fear. So I actually went looking, what is the response, the different response to glucose, fructose, and sucrose? Are they different? Now, is fruit sugar better than table sugar in terms of if you take a certain amount, 25, 50, 100 grams, if you take a certain amount, what is the insulin response? And the answer is they're not different. And the authors were kind enough to put white bread. That's not just regular, that is like Wonder Bread. You put that into your system without a lot of fiber, just a refined carbohydrate, and it behaves almost like pure sugar in terms of inducing an insulin response. So that's what we really want to avoid, that hyperinsulinemia, impairing glucose responsiveness, increases blood pressure, messes up your insulin, your lipids, as I'll mention in a bit, and accelerates the development of plaque. Now, we had a little discussion last night, excuse me, about ketogenic diets. And it's interesting that James O'Keefe, good buddy, he actually is on our nutrition committee, but he is a devout paleo person. And we, disagree with all of that, but you know what? We have one thing in common with the paleo people, and that is sugar. Our disdain for sugar and what it does to the cardiovascular system. So I do like to quote his article because this was really putting the sugar science to the test, and this article goes on and on and on. I'm just going to try to summarize it for you in one slide, which is hard to do. But the things to remember is that if you're trying to make sure that your cholesterol, and you can stop eating animals and take a statin and all this stuff, if your sugar intake is not curbed, you will still have more difficulty with the cholesterol than you should. Total cholesterol increases, the good cholesterol HDL decreases, triglycerides increase, and therefore you have that association between all these diseases and sugar. Now, the other side of that is actually inflammation. And you heard a bit about that last night as well, that maybe it isn't all cholesterol. No, it isn't. It's actually inflammation as well. And so good buddy Paul Ritker at the Brigham created an assay for this. And the funny story is that we all thought that Paul was making a mint off of the C-reactive protein assay. Turns out that he actually, half of it goes to, or some big fraction goes to Harvard University, and the rest he gives to an inner city tennis center. So it's a really cool guy. And he actually took the lead in terms of showing that those people who were always saying cholesterol is not the cause. Well, cholesterol is the cause, but it's not the only cause. There is inflammation. And so let's try to separate them out. This curve is talking about, and this is a Kaplan-Meier plot, meaning that as you go forward in time, how many people remain event-free? And you see it going down, 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 down. Well, in the American population, it's going to go down, event-free. That top area are the people with a low cholesterol and a low C-reactive protein, a marker of inflammation. And if one of them is high, and the other one is not, you sort of get those two intermediate curves. And if they're both elevated, dangerously high C-reactive protein and cholesterol, those are the people with the highest rate of heart attack, stroke, and death. So the reason that this wasn't just the recognition of how important it was, but the fact that it's treatable. And so we had a great discussion last night about statins, and my feelings that people who were saying that they don't work, they're just not looking at the literature. But should they exist? No, because they're taking care of diseases that, for the most part, are unnecessary. However, if you do have that at-risk population, you could use one of those statin drugs in a large dose, as was done in this Jupiter trial shown here. And let me just blow up that right-hand curve. It's about a 50% decrease in heart attack, stroke, and death if you're taking that statin compared to the people who don't take it. So should we congratulate ourselves at finding, the people who have come up with, and now 7 statins on the market, and they're being, and it was quoted last night that it's a $30 billion industry. That's partly the success of it. People say they're not tolerable. Well, 30 billion says you're wrong. It is tolerable. And if you have something that costs money and then keeps the person alive to keep taking it, you're going to that's a great money model, okay? But is it necessary? All right? And so this is actually the other side of it. Instead of just treating the LDL cholesterol, which some cholesterol medicines do, the statins actually reduce inflammation and cholesterol. The canakinumab that Dr. Esselstyn mentioned last night, I put the slide back in so you could see it. Paul Ritker actually looked at reducing inflammation only. And yeah, the same curves. Let me blow it up again, and instead of a 50% decrease, you got about a 16% decrease, but a decrease nonetheless. So cholesterol probably is a bit more important, but inflammation remains a critical target. Okay, so why am I keep talking about this? Well, because sugar has been known to increase both cholesterol and inflammation. And so this was the shock to most of us in 2014 when it was published that the more added sugar you have in your diet, the higher your death rate is going to be. And that curvilinear relationship between mortality and sugar intake was a shock to most of us. Most of us vegans are going around saying, if it doesn't have a mother and it doesn't have a face, it's okay, right? Not so, because sugarcane doesn't fall into that category, and it is actually deadly. Well, actually, have you ever seen sugarcane or bought sugarcane? It's got fiber in it, doesn't it? Okay, but people, when you take the sugar out of that, that's when the trouble starts. Okay, so one of the mechanisms for that is increasing the amount of LDL cholesterol, triglycerides, lowering HDL, increasing inflammation, and increasing diabetes. And so when you're doing sweetened beverages, it actually increases the likelihood, if you do one of those every day, and so many people do this, increases their likelihood of diabetes development by about 20%. So it's something that everybody should be very aware of, okay?